Hi, everybody. Thank you so much for joining this roundtable discussion. We are very excited to have Barry Smith here, a global health and public health physician, come and speak to us about some very interesting work in Honduras and the questions that his experience brings up. So let's get immediately into it. Barry, first of all, thanks so much for joining us.
My pleasure.
So before we get into the conversation, tell us a little bit about yourself.
Well, as you said, I'm a public health physician, now retired. Spent almost 40 years overseas. The first 7 of those with USAID in Honduras. Well, after having done a stint with the U.S. Public Health Service in Puerto Rico, which is our introduction to Latin America. Then, after the 7 years with USAID, I resigned, and we started an NGO in Honduras. I wanted to get my hands dirty, I guess, in terms of development. And so that has been almost 30-some years ago, and we're going to think that's hopefully part of the experience we'll be talking about today. However, since that didn't contribute to keeping kind of body and soul together, I did consulting work initially with Management Sciences for Health, and eventually ended up spending 25 years with the Management Sciences for Health, which is a global health organization. And it had about 14 months at one time with the American Red Cross in Central America in post-Hurricane Mitch relief, which is nice. So
wonderful. So working with some of the big names in development, yourself having been trained in public health and also a physician, and then you point to this work in Honduras as really being exemplary of some of the work that you've done and also some important lessons that you learned about that. Let's just jump right in. Tell us about the work in Honduras.
So I think for me, kind of working with USAID was my introduction to the kind of discourse about development. Certainly living in Honduras and working with the Ministry of Health, being exposed to some of the realities of health and life in a less materially well-endowed country. Then, as you know from our previous conversations, my wife and I are members of the Baha'i faith, and so part of my living there was also kind of interaction with the Baha'i community. And in 1983, there was kind of a new avenue of service kind of that developed in the Baha'i community that was trying to take the application of this set of principles and applying it to the social and economic development of communities and regions. So we decided that we would kind of form a local non-governmental organization and try our hand at development. And we chose, for various reasons, to start in an area of Honduras called the Mosquitia, which at that time was an 18-hour walk from the nearest ground transportation, and we would normally fly in a 5-seat airplane, which we filled up. Wow. That is, my wife and daughters and I, and it would often leave us in front of the house, actually, because our house was right on. And what I wanted to do was development. But as a friend of mine pointed out, these are communities that don't have physicians, so I can't be a physician and go live in this community and not do health care. And so I recruited a Honduran friend, also a Baha'i, and his family, and so we moved to this village and built a small hospital, clinic, and
what year was that?
That was in 1986.
Wow.
Yeah.
So let's pause there for a second before you get into what the NGO did. Baha'i faith, you're a physician. Where did you go to training?
So I did medical school at Indiana University, and did my MPH at University of Michigan.
Wonderful.
Yeah.
So trained in premier institutions. 1986, global health didn't really exist. It was international medicine. There was development. It wasn't the most popular thing to do. It definitely wasn't as popular as it is now, where a third of a med school class will be interested in traveling abroad. You were traveling with your wife. Tell us a little bit more about what it was like to be in your shoes at that point. You were looking at all of your career options. You have this premier education, but yet you decide to go to rural Honduras, walking for 18 hours in a place that sounds like it has a lot of mosquitoes, and you started working with fellows there. What's going on?
So I mean, for us, a lot of this has to do with kind of how we understood Baha'i teachings. The concept of the oneness of humankind, which is a core kind of a Baha'i belief. And I think the attitude of service, the principle of justice, kind of all of these were things that motivated us. I had, though I think from even an earlier age, an interest in living outside of the United States. And I remember my first year in medical school, I wrote a letter to WHO basically saying, you know, I'm in medical school, get ready, here I come. I got a response.
Did you?
Yeah, I mean, basically it said, you know, oh, wonderful, come back when you grow up. You know? But, during my internship, those things don't exist anymore, are they? The first years of residencies, but we had a 1 month elective, and I did my month elective with the Kent County, Michigan Health Department.
Wow.
Just, public health was my interest.
Wow, fantastic. And then your wife getting involved.
Yes, I mean, she was basically an educator, and the decision to leave, you know, I was a foreign service officer in the capital city with all of to go out and move to this village of, I guess it was around 500 people. Yeah, that obviously had to be negotiated, and our oldest daughter was 11 at the time, and we felt if we were going to do something like this, we had to do it kind of before she got much older. And our children actually told us this was the formative experience of their life, to their sense kind of social justice and of just living in this village, and their playmates were the kind of the village children. Really, we had volunteers that came down. There were 200, I think, over the kind of the 10 years that we were out there, from 11 different countries. And these were also, had such an impact on our children, just these altruistic youth coming in.
Wonderful. So the reason why I want to just shine a light on that for a second is because, a big part of global health, when it comes to people working and volunteering and working on projects, a big element that enables their participation is the familial decisions, but yet often it's overlooked.
Yeah, interesting, yeah.
And a lot of times people will leave these pursuits because of complications in the family.
Yeah.
But it sounds like you were able to sort of align these elements for great benefit to your family.
Yeah, and I think, that doesn't, notwithstanding the incredible challenges that there were during this time. And I think when we talked on the phone, I mentioned about there were a number of times that we were ready just to throw in the towel.
Sure.
I can remember sitting on the front porch and doing numbers in my head. I didn't see how in the world I was going to be able to educate my children. I tried to do the numbers. I just didn't, it just didn't compute. And But every time we were ready to kind of, or just feeling it, didn't see how it could go forward, we'd get this wonderful letter of encouragement from the Office of Socioeconomic Development at the Baha'i World Center, and we'd say, okay, well, we can't give up.
That's fantastic.
Yet, and yeah.
And maybe it's also worthwhile to speak a little bit more about the Baha'i faith. It has a number of values that very much are aligned with this type of service. And there are some people that perhaps have not been exposed to it. And then it's also worthwhile to say how much of these efforts were involved with religious education or proselytizing versus being inspired.
So that's good. So one, just for that last point, one very clear dimension of Baha'i socioeconomic development is the fact that it is completely free from, and it really is driven by a desire to contribute to the socioeconomic well-being of the population, irrespective of kind of their religious affiliation. So essentially, it wasn't a tool by which we tried to gain adeptos, what do you call the converts? Another, I think, looking at least my understanding of kind of central to this is an attitude of learning. So really trying to do and constantly reflect on doing is a key component. Consultation is another kind of integral part of the Baha'i faith. And the idea of consultation is that as the people involved in the process of decision making approach it trying to free themselves of predetermined outcomes and really understanding that every person has a perspective that, if heard, can contribute to a broader understanding, a deeper understanding of whatever's being explored. So I think that was another thing that we tried to use. And one of the ways, we used it, so there were two families, so we used it in both our development work and kind of the logistics of essentially living together. But one of the early things we did was to form kind of a community council, and that was another, with people from the different villages that we served, trying to create a forum that we would get input. One of the things that we talked about earlier, before we started recording, was also the principle of the members of a community having both the right and the responsibility to be protagonists of their own development, and trying to understand how, and this is the reason I think eventually we moved away from service delivery, which was the hospital, to the SAT program, which we hopefully will be able to touch on. Understanding the need to build capacity of the community of which we were a part to be able to effectively participate in, and ever more effectively, their own development. So those, I think, are some, and just the central role of service for a Baha'i, kind of the one of the expressions, most central expressions of worship is service, and it's kind of seen as the highest station to which a human being can aspire.
Wonderful. And I can see 1986, you walk into this community, you guys have set up a clinic, you're a physician yourself, you're driven by these pursuits, but then also you have a mechanism, a means by which to engage with people, along with a strong desire to help. And you start providing clinical care. And then, as you mentioned, and this is really what we're going to get into, you pivot and you start focusing on education and create the SAT program. Tell us a little bit about the SAT program.
Okay, so SAT is a Spanish acronym, Sistema de Aprendizaje Tutorial, translated as the tutorial learning system. I think, and I sent to you this article, the Brookings Institution recently at a kind of worldwide conference featured it, among some other things, as real innovations in education that they felt worthy of attention to share with the world at large. So the SAT program was developed in the 1970s by another Baha'i-inspired organization in Colombia called FUNDAC, Foundation for the Teaching and Application of the Sciences. And the people who were doing this, a lot of them were professors at the Universidad del Valle in Cali, Colombia. And one of them, Dr. Farzam Arbab, commented once that, he was going out and he was teaching, he's a theoretical physicist, and he was teaching theoretical physics in the university during the week. Then on the weekend would be going out kind of doing this as a Baha'i community development and thinking to himself, this country at that moment it's not physicists that it needs. And with another group of colleagues, and I think he was also the representative of the Rockefeller Foundation at that time in Colombia, began this process of what at one time they conceived of as a career path of engineers of rural well-being. So instead of mechanical engineer, these are engineers of rural well-being. And began this process and began through a process of really experimentation and so forth, developed eventually a curriculum for secondary education, the focus of which was really creating young people who could not only thrive in a rural setting, but could also contribute significantly to the development of their communities. And SAT has a number of innovations. One of them is that instead of a teacher and a student, you have essentially a tutor and a learning group. And you have a textbook, or actually there are 80 of these texts. And the tutor facilitates the group going through the text, and the learning is absolutely grounded in experience. One of the examples of this, which I think is just brilliant, is set theory. Now, when I think about set theory, when I got exposed to it with these Venn diagrams with a U pointed to the right and a U pointed to the left, and so they study set theory. Then they go out and they categorize the animals in their village according to domestic animals and wild animals. That's an application of set theory. And we do it all the time in our lives, in terms of classifying and in order to analyze and better understand it. But when I studied set theory, that's, it was disconnected from. They study statistics, and in science they study the digestive system. They go out and do a survey in their community of diarrheal disease and the use of latrines or not. And then they analyze this using kind of what they studied in the statistics. Then they go out and have a community meeting where they present this information to the community and analyze it with the community. I mean, that integrates, and when you think about it, we kind of study these disciplines in silos, but SAT really enables students to integrate and apply knowledge. They study economics and accounting. Then they go out, buy chicks, build a little chicken house, feed, weigh, account for how much feed, and then I think after 6 weeks, sell them. And so they're kind of what they're learning, they apply. It's a brilliant.
Well, it sounds like just better education, point blank. I mean, I would like to be educated that way.
Yeah, isn't it?
I would love my
Yeah,
son to be
yeah.
educated that way. On top of that, the thing that's also interesting is that it's utilizing tools on site.
Right.
So, it's not saying, hey, let's talk about how many times the basketball goes into the hoop if they've never seen a basketball.
That's right. Yeah.
Because the book was
That's
written
right.
in Washington, D.C. or Geneva.
Yeah.
On top of that, it's also using local folks that are trained as facilitators. Let's sort of zoom in on that a little bit for a second. This idea of having a facilitator as opposed to an expert. The fact that it's somebody who's local as opposed to shipping someone in. A lot of countries have this challenge of rural services. How do you get services normally reserved for an urbanized global society, which is largely the one that we live in? How do we get services out to people who are still in rural areas? And the long story short is that usually we don't, and then rural people fly into the cities to live in slums to try to get basically table scraps.
Yeah.
And a lot of times have a worse life with the semblance of a better life because they get these table scraps. This idea, instead of growing the rural sector in a way that's indigenous and respectful and has its own wisdom, that's a very interesting concept. And this facilitator, I think, is trying to sort of get towards that.
Right.
So what's a little bit, how did that facilitator work? How are they selected? How are they retained? How are they incentivized? A little bit more about that specific person.
So there are some kind of minimum qualifications. They have to have completed secondary school and be in university training or have had some university training, native to the village that they're living in. So then I think part of this, it on the one hand, it does provide an employment opportunity in their village.
Mm-hmm.
So, but kind of central to SAT is also identifying people who capture the vision of what this program is about and really see themselves as participating in a process of developing their community. And that these, and the tutor actually is with that group for the whole 6 years of their education. And there's an opportunity in this, I think, the Brookings article. If there are tutors that just aren't, don't have that commitment, then there's an opportunity to replace them. And the role, this is another interesting thing about what we're doing in Honduras, is the partnership with the government. So the government pays the salaries of these tutors. Bayan, largely, that is the NGO that they is responsible for the selection and the training of the tutors. And this is something that, given the fact that capturing the vision and the spirit of what SAT is about is so central to its success, is one of the reasons that Bayan assures that it does that portion of the kind of program management.
What I'm hearing a lot in these facilitators, a similarity to community health workers.
Yes, I think so.
The idea of someone local, the idea that someone is trained to then provide services to their communities. And yet, how is your impression about long-term retention, efficacy, and what do you think were the primary drivers of retention and efficacy? it sounds like they were paid, which is
They're paid.
incredible.
Right? Paid by the government, although it is some of them, and this has been an ongoing struggle, may go a year or a year and a half until, the payment finally comes from the government. So, I wish that our executive director, Sohel Duki, who's in Honduras, were here to kind of contribute to that. The principal thing, I think, is they capture the vision and they participate. They see the results of this. To me, it's like, one of the things I've taken up since I retired was gardening. And there's a certain joy that comes from watching a plant grow. And I think the SAT program releases human potential. And, there's something I think that just inside of the tutor, seeing that, it just in itself. And the kind of feedback that the tutor gets from parents in these communities, one of the problems with education and parents, there's a cost to educating your children. It's lost labor, particularly in rural communities. Often, there aren't secondary schools in the village. They have to send their children away for secondary education. There's a cost of boarding, and particularly with girls, there's concern about adolescent girls being far away from home.
Safety.
So I think parents see that this program is useful education, is education that, and parents see their children change, because we haven't talked so much about there are aspects having to do with character and kind of this commitment to community. And another basic Baha'i principle is about unity and how it builds unity in the family, it builds unity in the community. And so I think all of these things, so the teacher is getting positive feedback, seeing the results with their students, and hearing, kind of the interaction in the community. I think these are really strong motivators.
Fantastic. And one thing that I'm reflecting on as you're speaking about this is that when I think of the analogies to community health workers, one, the payment is an enabler, even though it comes irregularly, but that's often the case because disbursement of funds is often very difficult. Hopefully the cell phone payment systems will help. Rural, that's a way to get money out to rural areas, just send it through the air. But then also that there's this, what people call intrinsic motivators. And it sounds like, the primary best intrinsic motivator is a good job, a job that's effective, that actually you see the results. A lot of times people talk about how, T-shirts and bicycles with a branding on it is intrinsic motivator. That might be some support, but really, did you make a job that actually was making a difference, that was worth doing? People will often continue to suffer poor disbursement and other stuff if the job's a good one.
That's right.
So you guys you created an incredible, you're in this small community, you have a strong partnership with external expertise from the United States, you have local experts, then a sort of foundation for people in the community to communicate and iterate on the model. And you guys are small and beautiful. But as they say, small is beautiful, but big is necessary. So walk us through a little bit what's been the story since.
Okay, so
you guys
we were in this village, and we began this process in 10 villages. And they were basically indigenous villages. Garifuna Indians on kind of in one direction, and Mosquito Indians in a second direction. And we're also now got, since this is a formal secondary education program, we're working with the Ministry of Education, so we get them on the last day in office of a government. We get the signature that authorizes this as an experimental program. So we carried out, and enormous problems. It's not known. I mean, parents, what we want a high school. We don't want our kids in this group, and so we limp through the first couple of years, and the Ministry of Education comes out and does an evaluation. And what they found was that in math, they looked at math and language, and math, our students from these very poor rural performed much better than the national average in math, and in Spanish they were par.
Wow.
Now, that may not seem so significant, except for these kids, Spanish was their second language.
Wow.
They were from kind of indigenous groups. So that really opened up with the Ministry of Education. Oh, geez, this is really interesting. Now, at the same time, we realized that as opposed to we chose the hardest place in the whole country to do this.
Right.
If it were really going to expand, we needed to get into a larger population area. So we essentially moved the kind of locus of program kind of management and planning into what was then, I guess, the third largest city in Honduras, La Ceiba, which was up on the Caribbean coast. And so from there, based on these results, and with our initial financing was from the Canadian International Development Agency and the Catalog Foundation. Then the UK Department for International Development gave us a 5-year grant. And of course, the results from these early things helped.
Sure.
In that regard. We were able to expand it kind of outside of the Mosquitia, this remote area, and it became much more visible. And, the Ministry of Education, people interacting with it, at least at the departmental level, it was more visible. And I think from there, it just, the results spoke to themselves, or for themselves. One of the other stories, and the executive director has talked about writing a book about this, but was interacting then with the government. And, governments come and go and parties change, and so many attempts were made to, use this for political patronage of tutors and so forth, and the amount of energy and the skills that were required at the ministerial level to really protect the program from kind of becoming which would have just totally, I think, undercut it. We've been able to do that, and now it's kind of has a certain, it's got its own line item in the budget, and a number of kind of formal agreements with the government that protects it, but it's still, this is just something that has to constantly be guarded.
So because I'm trying to think of groups that do similar work, right, where they have a small sort of test kitchen that's driven by deep principles. They do this incredible initial work, are incredibly successful with this community. A lot of times that's driven by a love of that community,
right?
A strong desire to help a certain population. You guys, the pivot point was when you had that initial analysis. And when the government came out and looked and saw the results in math and language, this is inside baseball, but it's relevant to people who actually maybe are sitting right now on top of a small golden goose egg saying, do we call the ministry and say, come and check us out, come and listen to us? What sparked that? Them coming out to the
Well, I think the fact that we got this as an experimental program.
Mm-hmm.
So they, this was in a sense on their books as an experiment. So it was largely their initiative. Okay, these guys are out in our name doing this kind of educational process.
Sure.
Let's go look and see whether we can continue to lend credibility to that. So I think the important thing was having created that relationship. Now that in itself was a process.
Mm-hmm.
Trying to think now who it was, but there was funding that was provided for Minister of Education people to go down to Colombia to look at that experience. So we had in the Ministry of Education 2 or 3 people who were our promoters, who understood and loved this program, and they were central, key to making sure that kind of the steps that were required with the Ministry of Education were. So that's kind of a whole other story about kind of how the credibility of the program was built within the Ministry of Education itself.
And that's a fascinating tension because you guys have local advocates in the ministry that are saying, this is incredible stuff, this is a great test kitchen, they're teaching us the better way of doing rural education. And then you have this report that says they're doing incredible work, it's better than what our old way of doing stuff. Yet you know that a big part of the success is this fidelity to a certain spirit and communication and patience, perhaps. Now you have a political process that says, all right, this works, let's magic bulletize this, let's turn it into a political quick win. I need that, by the way, to happen within my political timeline, not within the timeline of your capacitation and all the other stuff. So let's do it. And then you push back. You say, no, we don't want to do that. Now, this is not unique to just your experience along with colleagues in Honduras. You think about the Harlem Children's Zone, which is in Harlem, that has an incredible educational experience, that has great opportunities for expansion. You think about all the charter schools in the United States. You think about even in Boston, where a lot of people look at the underperformance of public education, and then where does the charter school or some private schooling and the techniques that they use, how does that then get split over? So what advice, I guess, would you say? I mean, we know what history has shown, that you guys decided not to hand over whole hog and say, okay, turn this into whatever you want, expand it nationally. It doesn't really work. People say, you can't use facilitators. What you need is experts. We'll just bust them in. You guys decided instead to go slowly, grow iteratively. What's the story since then? How has that tension, and if you have maybe perhaps some examples of where that tension played out in a smart growth, but growth nonetheless?
Okay, so I should say that we actually did get pressured once into doing a rapid expansion. It was the Inter-American Development Bank said, we have a gap of 100,000 youth we need to reach. We love SAT. How many of these can you do? And, we'll give you the resources that you need, of course, channeled through the Ministry of Education. So we did something fairly ambitious in terms of expansion. Then came a coup, and USAID and IDB and others cut funds to the government. But we already saw that we expand too fast, we lose quality. So we managed to beg, borrow, not steal through this process. This is, another period that teachers went maybe 2 years without getting paid, and
Right.
and until things got worked out. So one of the things, and actually anticipating this question, I chatted on WhatsApp this morning with our executive director.
Okay.
And one of the things that he commented, and this just has to do with organic growth. He says now we have, 20 years of experience. We have hundreds of people who've graduated from this program. Some of those have become tutors. So these are people now who have grown with the program. So we're in a position now that expansion is much more feasible because there's a cadre, a generation almost of people who have grown up with the program.
Right.
So I think, to me, that was an interesting observation. And so much of development with external financing, you have these 5-year programs, evaluate, and it just doesn't work like that.
Yeah.
And I think, this is essentially a generation, 20 years investment is now puts us in a position where the potential is there for expanding it.
I mean, you think of that alumni network, that experiential learning. I mean, if you think of the way that, for example, world religions have spread, some have spread by that process. Someone gets taught, then understands deeply. Buddhism, for example, spread this way. It's not the worst way to grow iteratively.
Yeah.
It's a slow creep,
Right.
mind you, but yet it might even stay closer to the mechanism. Other people would argue, what if we can't wait, right? I think people look at the world right now, they say, the world's in a pretty dark place, and we need good solutions to go big quick. Are there elements that you think would be very important to really facilitate that? Mind you, if let's say you were playing Sim Planet, and that's like a simulation game, and you could manipulate all of the elements to create the perfect context for this program, for SAT to expand and stay true to its core. What would those elements be? Is it stuff in the government? Is it a financing question? Are there mechanisms that need to be implemented quickly, or is there just stuff that's just a slow cook?
I think it's the latter. When I worked in USAID, I had one of my supervisors had spent most of his career in Africa.
Yeah.
And he told me that there was an African saying that we're in a hurry, so we have to go slowly. And, in most of my career in public health, I've seen this tension between quality and coverage. And I've mostly been involved in the coverage expansion. And I would have, at one point, said it's more important to have bad services broadly available than good services only for a small number of people. But look what we have. After so many years, what we have is bad services all over. So I think, in retrospect, and to answer it, it really is to understand if we want a long-term, permanent solution, there are just certain kinds of things. This is, to me, this idea of an organic process. When we lived out in this village, we planted 50 citrus trees. And I've often thought, if this were a development project, there was a drought, and after 1 year, they're kind of scraggly, in 2 years, they're growing, and 3 years. If somebody had come in and did a midterm evaluation as a fruit producing, and said, it would have been kind of canceled or failed. But after 5-6 years, the roots are down and the abundance of fruit. So I just think that you can't see something that works someplace and, like a tree, kind of chop off the visible part, carry it, set it down, and expect it to grow. It really, the roots that have to do with things like we've talked about, the motivation and a vision and kind of these principles of community involvement. And I think, the people conducting it, this is kind of 40 years of reflection. So this is really required. And if we do that and we're patient with it and nurture it, and it will eventually, we won't have the disaster that we have now, and kind of looking at, in general, development and
it makes a lot of sense. I mean, you think of how many quick, poorly implemented solutions came on wave after wave after wave. What if we made a commitment?
Yes, that's right.
20 years, and then we'd be in a better place.
Yeah, that's right. Instead of these 5-year, I don't know who invented that, but, kind of these 5-year projects, but really to have a generation project or 2 generations.
Right. Well, it's interesting because, there's some terminology here that I think facilitates this short-term thinking. One, the idea of what's your exit strategy.
Yeah.
Is it sustainable? What I've often found is that when people are talking about sustainability, is they're really talking about how can we get out, so that the group themselves can do it themselves, and that is, a lot of times ignores the way that resources flow, the way that resources are extracted, often unfairly. Instead, what I'm hearing here is that we're not worried about sustainability, we're talking about sustaining something.
Yeah,
so it's about a commitment, long-term commitment. This program is very, quote-unquote, cost-effective. It doesn't require, to build a skyscraper in every rural community, but it is high value.
Right.
With the investments that you make, and they're real investments, salaries, books, time, probably a lot of overhead and logistical costs, you then get a generation of young people who have intelligence, real skills, but also what some would call soft skills, EQ skills. Right. They have mind you, I would love some of that for Boston, or other urban cities, where you see young people who are fundamentally disenfranchised from themselves because their primary educator has been a very toxic education.
That's right.
Something online, something, bullying and the rest. What you're getting is basically a happier, healthier human being. And that is a slow cook.
Yeah.
That is a slow cook. That you have to put that on the long path. So it's interesting. I thank you very much for coming.
Well, thank you for the opportunity. And this isn't community health, it is community development.
Yeah.
And as we talked before, I mean, health and education, there are a lot of similarities. They're the probably 2 public services that most broadly touch people, most visible, most present. Often in what I've seen in the countries I've worked in, the 2 budget line items that are the highest in, so they're really, and this coverage quality tension between the 2 is another one that at least I've seen that they share. So thank you very much for the opportunity. And
wonderful, and it's great food for thought. I know that the people who will be listening to this are I think a lot of this will hold resonance. If they, on the website, chwcentral.org, this link will be hosted. There will also be access to a video that was made about the program and the link to the Brookings Institute. So they'll be able to read more about it. But what would be next steps if people were interested?
So I think the Brookings document has a lot of, right at the end, it's got a lot of references. But they can also, Google SAT, Sistema de Aprendizaje Tutorial. They can Google Bayan or Fundeak.
And how do you spell Bayan?
Bayan.
Okay.
Yeah.
As it sounds.
Yeah. Yeah.
Great.
Good.
All right. Well, final word goes to you. To these listeners who are people in development, in global health, in community health, who are right now sitting on top of their golden egg, and they understand that it's a long cook, and they're in it to win it. They're in it for the long haul, but they're struggling. What's your advice for them?
I don't know. Well, I think I mentioned to you also that whether this goes to your question, I don't know. But that in kind of the analysis throughout the world by the Baha'i community of success, I have been told that it often is related to the kind of purity of intention of those who are doing it. That we're doing it not in order to have fame, have glory, or income, but really kind of driven by this desire to serve. And another thing, my daughter, who lives here, mentioned that she had heard as well, is that the most successful within the Baha'i context, kind of these development efforts, have not been people who said we're going to go out and do something really big. That they began small, and just with this attitude of learning, and grew as a result of this. I mean, a little bit like what you described your experience in Mexico. You go with this intention, and that didn't work very well, so let's analyze it and talk to people and go back and do it again, and kind of this action reflection.
Well, I think that's a wonderful mechanism to stay in it, and also to constantly be challenged and renewed by the process.
Yeah, that's right.
And that's wonderful. So again, thank you so much.
Thank you. It's been a pleasure. And yeah, good.
Thank you.
Okay.
All right.